Okay, I'm Jaci Scott. I'm the speech language pathologist. I treat patients in our outpatient rehab clinic, and I also treat inpatient over for swing bed and acute care patients up on med-surg. I treat across the lifespan. I get to treat babies from about 18 months old, sometimes a bit younger, all the way through end of life. So I get to treat a variety of diagnoses. I have specialty certifications as a advanced certified autism practitioner, as well as a certified dementia practitioner. So I get to utilize skills in a variety of ways, so each day looks a little bit different for me, which is great. But we get to, across the street over at the rehab clinic, we get to treat a lot of kids with autism, and that to me personally is a very big need in our community and really in our area. So I'm happy to provide those services. Seeing kids be able to have their first word is a sacred moment for me. I enjoy having parents and caregivers in the room so that they can see the progress that's made. If the kid can handle a parent in there, I want them in there because I don't want a parent to miss something big. So hearing a child be able to tell their parent that they want something and use words instead of behaviors or screaming is a big deal, or call mom for the first time. That to me is just, that's sacred, and that I get to be part of that moment. But also being with people at the end of their life to help facilitate communication and to facilitate some comfort in being able to swallow without choking. That is also very sacred and something that I do not take lightly. So there are two instances of people in our community that I knew prior to working here that I feel privileged to be with at the end of their lives, and that is something that I also consider sacred, and I don't take those moments for granted. Well, as an employee, I love working here because I feel like it truly is a family atmosphere, whether I'm up on med-surg or I'm in the rehab clinic. I work among friends and people who truly care about what's going on in my life. I don't feel like I'm just another employee, another number. I feel cared for from administration all the way down. So that is a blessing to me. People know me and know my kids, and so and there's some understanding in that as well. When you're having a rough day, people care about that. So as an employee, that's a big deal to me. And I also feel very supported in what I do. And I feel like I have the freedom to focus on patient care rather than meet numbers and quotas. I get to treat the patient. It's patient first for sure. And so that would bleed over into why I would want to come here as a patient or bring family here as a patient, because it is patient-centered care. If I was working in a larger hospital, if I was working in a trauma center, I would be delivering the same type of therapy there as I am here. So it's the same with our physicians. It's also, my caseload here is a little bit less than what it would be at a larger place. So I have the time and the resources to really spend with the patient.